I'm talking to you from one of the epicenter of this COVID crisis in Europe. We were asked to preserve the hematologic activity of the ward, so the inpatient and the outpatient ward, but we were asked also to give half of our physicians and nurses to assist the many patients who were coming into the hospital. In Italy, during the first 3 months, the overall transplant activity has not declined. So that means that if you put in place a good organization, you can have and you can preserve your standard of care activity.
Main effort is to maintain the hematologic units COVID-free in order to give the intensive therapy, at least for conventional therapies. The therapy that is not strictly necessary should be restricted especially in the peak of coronavirus incidence. We will give all types of treatment in patients. We do not restrict any therapy, except transplantation, because practically all the ICU resources in my hospital at the moment are occupied by COVID-positive patients.
It's always a good idea when they care for a patient who is positive, for example, that you pair one nurse or one doctor who is experienced in using PPEs to supervise the first time someone who has been trained but is not that experienced. You can leave some telemedicine, some phone visits to those who have symptoms or even those who are COVID positive, but they are well and at home. They will be probably willing to help the colleagues that stayed in the hospital.
They should restrict the risk of exposure to infected individuals. They should refrain from non-necessary travel. The patient must take and pay attention at home before the beginning of the conditioning. Whenever possible, the transplant should be deferred at least by 3 months. And finally, what is very important is that the patient should be tested, possibly repeatedly, before the conditioning is started.